Hi nurses, welcome to this class on medical surgical nursing best practices. This class will be offered to nurses on the medical surgical unit to further their understanding on important topics. These topics have been identified by floor nurses or nurse leaders as topics that nurses often misunderstood or lack knowledge of. Therefore, in these sessions, we will cover a variety of different topics. First, I want to identify what it means by best practices. Best practice is defined as a practice or procedure that is accepted as superior to other practices. What do the most recent guidelines say about these topics? We will review them. I will share all of the research and answer any questions that you may have. Topics that the nurses identified included neurological acute stroke, nurses' role in identifying acute inpatient strokes, assessing, managing, and treating them. As we all know, time is brain. What is the most important task to complete first? Do you send the patient to CT before drawing blood or doing the stroke scale? All your stroke questions will be answered during this class. Substance abuse and the Clinical Institute Withdrawal Assessment, otherwise known as the CWA scale. What is the nurse's role in assessment, and what are the best practices for care of these patients? How often does the nurse have to assess? What is the timeline for withdrawal? And how do you properly prepare the patient for withdrawal symptoms? Who should be on the CWA scale and who shouldn't be? These are all questions asked by staff that we will cover. The cardiovascular topic identified by staff is the implications of the sequential compression devices. Who, what, and why? Seems pretty simple. However, nurses often identified that often SCDs would be taken off by other staff or the patient and left off without their knowledge. How does this impact the patient? What steps should the nurse take in educating the patient? If it is important for the nurse on the floor that you understand how to care for patients in DVT and VTE prophylaxis and why you do the things you do. Other topics included is monitoring the blood transfusion patient. The nursing staff noted that there was a recent change in protocol for blood transfusions, making it mandatory for the nurses to sit with the patient during the first 15 minutes of transfusion. Other safety measures are taken at the facility, such as dual sign-off. So the staff was wondering, is this actually best practice? What is best practice? If they do identify a blood transfusion reaction, what should they do? Could unlicensed staff stay with the patient and notify if any issues were to occur? Blood transfusion reactions can happen to anyone. It is important that the staff is well versed on how to assess, manage, and treat each patient. You will learn all of this during this unit. The next topic identified by nurse leaders on the unit was the need to review intermittent catheterization. What is the best practice for use? Nurse leaders noticed an increase in the use of indwelling catheters, and one led that CAUTI, catheter-associated urinary tract infection. They were wondering if this was preventable. If the staff was better educated on sterile technique, early discontinuation of Foley's, or intermittent catheterization, could this have been avoided? The nurse leaders want to know what the answers are, and the nurses need to know why we do such things. This is why it's an important topic for the medical surgical floor. The last topic identified by staff was the best practices for early mobilization and postoperative elective and knee and hip patients. This was already implemented program, and the staff want to know why. What should be focused on in the first movements? How to best educate the patient and the family about early movement. The staff noted that while they may feel comfortable moving the patient postoperatively, oftentimes the family and the patient were apprehensive about moving. They just didn't understand why the nurses were doing it when they just had surgery a couple hours ago. What positives were seen in the patient that were moved early? Is it safe? All of these questions will be answered about early mobilization in postoperative patients. I look forward to teaching you all about these topics and answering any questions that you have as we go along. I hope that you're able to learn something about them that you did not know before and are able to use the knowledge to better care for our patients on the floor. If you have any further questions or know of any topics that should be included in future classes or this class, feel free to email me, text me, or seek me out on the floor. I'll see you soon.